Hello, I am Dr. Michelle Afonso. So a dental injury can come from a fall, from an accident. So I want to give the general idea of what to do and what to expect for mild injuries called a bruised tooth or a concussed tooth. This is cold sensitive as well. When this happens, one of the good things you can do, you want to go on a soft diet if you have this type of injury. And we let it heal, and it typically subsides on its own with the help of those NSAIDs. Is a tooth that was knocked out of its place but is still partially attached. What you will do when that tooth gets pushed out of the place that it originally was from the impact, you want to take the tooth by the crown and you want to grab it and you want to push it back, healing once that tooth is out of place and that socket has an open space. And what the body does is it starts forming a blood clot. But if the blood clot forms before you push that tooth into that space, it's going to act like a blocker. So it won't have that path to insertion. Push it right back as close as you can to where it should be. And then you come to see the dentist. Take some NSAIDs if you can. With dental injuries, it can be very case by case. So we're giving you a flexible wire that you need for a root canal. And I don't want you to worry when it initially happens. Just get it checked out and have your dentist take a look at it. There's more action that you want to take in the moment it happens. The things you want to do, first thing, that's the crown of the tooth. That's where you can grab it. The root system will be the pointy end, and you want to leave that alone. Don't brush it, don't clean it, don't touch it. The reason you put it right back into the socket. Similar to the case before, to avoid that or you're unable to get that tooth back into the place that it was in the mouth, your next step is to store that tooth. So the way that you should store that tooth, the medium that it should be put into, is milk. So milk is one of the more reason why we like putting the teeth in milk is because it's a pH neutral solution, a good solution for the teeth. So water is a hypotonic solution, so it can actually damage those very important cells out. And you want to go see your dentist as soon as you can. I mean, within the next 30 to an hour, and debris that can also damage those very important cells of those teeth. More treatment when it gets completely knocked out. So you don't want to panic and it's when you have trauma to a tooth, especially trauma that is enough to knock a tooth out of its place, is dying. And when that happens, someone can notice if one tooth is more gray than the other. So don't worry if you have a history of trauma and your dentist is giving you regular follow-up the injury. Call up the dental office, you'll get someone on the line and they should be able to give you some basic instructions on what to do.